Firstly, in the last 24 hours there have been 5 cases of coronavirus notified to the Department of Health. These include 3 cases that were announced yesterday afternoon. All are primary close contacts of confirmed Holiday Inn cases. There are now 19 active cases of coronavirus in Victoria. Some 24,209 test results were received today. That now takes the total up to 4.652 million test results that we've received since the beginning of this global pandemic. Can I personally and profoundly express my gratitude and give my thanks to those 24,000 Victorians who got tested yesterday. It is critically important, and again, I just send a message to every single Victorian. The one really critically important thing that you can do is to get tested as soon as you register any symptoms whatsoever. That is the most important thing to do in order to keep your family safe, and indeed every family safe. Now, Victorians will be well familiar with the term UK strain, UK variant of concern. We have talked about this for a long time because it is so hyper-infectious and moves so fast that it is presenting a very, very real challenge to our status, our stay safe, stay open, our precious thing that we've built, all of us, throughout 2020. Now, whilst we don't have cases outside those that were notified as possible close contacts, those who had been by virtue of who they'd been with or where they had been, whilst it's not surprising that we're seeing extra cases within those groups, and in some respects it's pleasing that that's where those cases are, the way in which they are presenting is a very significant concern to us. If I can just give you a couple of examples, I'll make the point this way. We are having cases test positive, and we, in rapid time, we get notified of that positive test result. By the time we find that case as positive, they've already infected their close contacts, their family, people they live with, people they've spent time with. That makes it incredibly difficult to do contact tracing, because there is no gap, if you like, between when we have the first case and their close contacts and potentially others that they have spent time with. The whole process, because of the hyper-infectivity and the speed at which this UK variant moves, the whole process has been condensed down, and it is now, I am sad to have to report, it is the advice to me that we must assume that there are further cases in the community than we have positive results for, and that it is moving at a velocity that has not been seen anywhere in our country over the course of these last 12 months. Now, what I'm about to announce is all based on public health advice. Victorians have heard me say hundreds and hundreds of times that the doctors who saw us do what no other part of the world has done, defeat a second wave, are the same doctors, the same scientists, the same experts that will see us avoid a third wave. The challenge that I have, and the challenge that all of us will have to confront, is that if we wait for this theory that it might be out there, there might be more cases than we know about, if we wait for that to be proven correct, it will be too late. And then we will face the prospect of being locked down until a vaccination is rolled out. A vaccine is rolled out to vulnerable people, to a very large number of Victorians, a significant percentage of the Victorian community. That's months. That's not days or weeks, that's months. It's not a criticism, it's just that it's a complex process and it's going to take some time, and it's not here yet. So, because this is so infectious and is moving so fast, we need a circuit breaker. Therefore, I'm announcing, on advice from the Chief Health Officer and after a meeting of relevant Cabinet committees and the full Cabinet, that from 11:59 p.m. tonight, Victoria, all of Victoria, will go to stage 4 restrictions, and I'll take you through the details of those. There probably won't be an exhaustive list. There will inevitably be questions that will be posed, and we'll deal with those throughout the day. But from 11:59 p.m. tonight until 11:59 p.m. on Wednesday, so for 5 days, the following will occur. There will only be 4 reasons to leave your home. shopping for necessary goods and services when you need those things and only what you need. Victorians are well acquainted with this. We've done this before. Victorians know what to do, and they know that these tactics, this type of response works. But I will, just for completeness sake, take you through the list as it stands now. Then I'm going to ask Brett to speak to the hyper-infectivity and the speed with which this UK variant is moving. Shopping for what you need when you need it. Caregiving and compassionate reasons. Essential work or permitted education where that cannot be done from home. Exercise for 2 hours per day with your household members, your intimate partner, or one other person who is not from your household or your partner. You must stay within 5 kilometres of your home, other than for permitted work, or if you need to go shopping for things you need when you need them, and you cannot access those things that are, again, common sense tells you if they're essential, if they can't wait till Thursday, then you would be permitted to be beyond the 5 kilometre limit. Masks must be worn everywhere in Victoria other than in your home. Private gatherings, so there will be no visitors to anyone's home. They are not permitted. Public gatherings are not permitted. If you can work from home, then you must work from home. Schools will close, but will remain available over those 3 days, Monday, Tuesday and Wednesday, for vulnerable children or for the children of those who are permitted to go to work, those who can't work from home. Childcare and early childhood centres will remain open. If this was a longer period, we would look at that decision, but we believe that it is better to keep those settings open and allow people to continue, for instance, to work from home or go and do permitted work, given this is a short, sharp circuit breaker rather than a more prolonged set of rules and restrictions.